Continuing on in our series of health assessment videos, this is video number 3. We are moving down to the lips and mouth and neck. To begin, washing my hands again. To begin, we first inspect the lips. We're looking for color of the lips, if they're dry, if they're moist, if there's any sores or lesions, cracks, things like that that might concern you that the patient's dehydrated. Then we'll have our patient open their mouth, and when we get into the mouth, there's several things that we're going to assess. Open up. So the first thing you're looking for, again, this is inspection with your pen light, are the teeth. You want to take a look to make sure to see, first of all, if they have all their teeth, if they're broken, if there's some decay going on, if there's an odor coming from their mouth when you are inspecting. And then the other thing you're going to be looking for in their mouth is the soft and hard palate. Is it pink? Is it moist? And also viewing their tongue. And you'll have them pick up their tongue and checking for lesions underneath the tongue, and those look nice. And open up wide. So again, you're looking for the gum line of the teeth to make sure there's not a lot of gum disease going on. You're looking to see if the uvula is midline in the back of their throat. You're looking to see if they have their tonsils or if they've had those removed, if there's any sort of inflammation going on there. So a lot to look at in the mouth, and it does take some time to do a thorough investigation. We're moving now on to cranial nerve 9. This is the glossopharyngeal, and what you're going to have them do is ask the patient to open their mouth. You're going to ask them to say ah, and what you should see is the uvula and soft palate in the back of the throat should rise symmetrically on phonation, and phonation means with the noise of saying ah. So if you open your mouth, and can you say ah? Okay. And her uvula and soft palate do rise symmetrically, and it's important to assess symmetrically because if your patient's had a stroke, there may be an asymmetrical rise for cranial nerve 9, again, glossopharyngeal. Cranial nerve 10 is the vagus cranial nerve, and that is the gag reflex of a patient. And what you would do is use a tongue depressor, and you would put it in the back of the patient's throat to elicit the gag response. We're not going to do that today because in some patients it does actually make them vomit if they're very sensitive to the gag. So that is the vagus cranial nerve 10. Cranial nerve 12 is hypoglossal cranial nerve, and it's the range of motion of the tongue. So I'm going to instruct my patient to stick out their tongue. Can you move it up, down, side to side? Okay. So again, that's cranial nerve 12, hypoglossal, and she's able to do those without difficulty, so cranial nerve 12 is intact. So that is the mouth. We then move down to the neck. And again, just like we start every assessment, we first start with inspection. We're looking at the neck, first of all, with skin. Is skin intact? Is there bruises, lesions, cuts, lumps, bumps? Those things that we've been assessing for skin. The other thing that we're looking for is the position of the trachea. We'll palpate it here in a minute, but you initially look, is it midline? So you're looking around the trachea for any obvious enlargement, any goiters, enlargement of the thyroid gland that may be visible upon inspection. And then once you've done your inspection, you move on to palpation, and we're going to palpate the trachea to begin with. So to find the trachea, you're finding your landmarks, clavicle in the middle of the clavicles to come together to the sternal notch right here in the middle, and should be the beginning of your trachea. You should be able to walk your fingers up the side, feeling for any tenderness. Any tenderness with this? You're also able to feel the C-rings, the cartilage rings that are around the trachea to give it support. So her trachea appears midline with no tenderness, so that is a normal finding. Another aspect, once we've palpated the trachea, that we're going to assess on the neck is the carotid arteries. The carotid arteries are the big arteries that come off the aorta, take oxygenated blood to the head. Again, they're on both sides of the neck. So to assess the carotid arteries, we're going to start with auscultation. And the reason we start with auscultation is that we're listening to see if we hear any bruits. And remember, bruits are that whooshing sound that we hear with the bell of our stethoscope that could indicate there is some constriction or some blockage within that artery. If we do hear a bruit, then we know that there's a possible blockage that we wouldn't palpate, because with palpation, there is a chance that you're going to break some of that plaque off the walls of the artery, and then it could cause a stroke. So we always start with auscultation of the carotid arteries first. So what I'm going to do is take a listen to each side. I'll have the patient hold her breath so her breathing doesn't interfere with my assessment. So again, the bell of the stethoscope. Take a breath. Hold your breath. Okay. And again, we'll listen for bruits. I did not hear anything, so now I know it's safe to go on and palpate her carotid arteries. Again, when we get ready to palpate, we don't want to palpate both sides. This is one time where we don't compare sides, because like I said, with the carotid arteries are feeding oxygenated blood to the brain. So if we actually palpate and occlude both sides, we're really impacting the amount of blood flow getting to the brain. Patient may become lightheaded. It may cause a vagal effect. They may pass out, that sort of thing. So we do one side and then we do the other to palpate. And again, some landmarks, you find the sternal notch and up on the side, the neck, palpating with those pads of my fingertips. Okay, and she's got a strong 3+ pulsation in both carotid arteries there upon palpation. Another aspect that we assess now in the neck is lymph nodes. There are many, many lymph nodes that run throughout the body, which are going to be responsible for 9 lymph nodes that are on the face and neck and across the clavicle area. And I'm going to walk through those now with the names and how we assess a lymph node. Normally, you cannot feel lymph nodes. They should be upon palpation. You should not be able to feel them. Lymph nodes' function is to gather up any bacteria or anything that's going on in the patient's body to try to fight off an infection and things like that. And once that happens, they become inflamed or enlarged, and you're able to actually palpate them in somebody that has an illness and infection that's going on. So we're going to go through and assess 9 different areas of lymph nodes. Begin with in front of the ear. Ear is your auricle. So prior to the ear or before the ear is pre-auricular. And again, when we assess lymph nodes, using the pads of our fingers, the 2 fingers here, and kind of just doing a circular motion around. If you were to feel the lymph nodes, they would be circular, hard areas that you would feel. So you want to, as you're feeling around, you want to have the patient let you know as we assess these if there's any tenderness with that. So this is pre-auricular, and then post-auricular, which is behind the ear. Again, you're just kind of doing that circular motion. Occipital. Occipital means eye, so back behind the eyes on both sides. Tonsillar, where your tonsils are, so down here, you're feeling for those lymph nodes and tonsillar. Submandibular, your mandible is your jaw, so along the bottom of your jaw, walking your fingers to feel if you can detect any lymph nodes there. Submental is right on the chin. Do you not feel anything? Anterior cervical chain, and then a posterior cervical chain. So you have lymph nodes that run along the anterior part of your cervical chain and then your posterior part. So you're going to just kind of walk your fingers down. And then again, posterior cervical chain in the back. As well as across the clavicle area, you have a line of lymph nodes that run there too. So you're going to assess supra, which means on top of the clavicle, so supraclavicular. Okay. Any tenderness with any of that? No. Okay. So assessing those 9 areas, I did not feel any lymph nodes, and she did not have any tenderness, so that is all a normal finding. Next, we're going to move on to cranial nerve 11, which is a spinal accessory cranial nerve. That controls motion of the neck. We're going to check her range of motion, first against gravity and then against resistance. So I'm going to instruct her to bend her head forward, tip your head back, side to side, and then can you shrug your shoulders? Okay. So she's able to do that with ease against gravity. Now we're going to do it against resistance. So forward, back, side, side, and then shrug your shoulders. Okay. So again, she does that with ease against resistance. So that tells me that cranial nerve 11, the spinal accessory cranial nerve, is intact.